Hi, welcome to today's Leaders in Mental Wellness and Diabetes, where you will hear insights from the top minds in the world of diabetes care, hosted by Dr. Char.
Hello, today we have Marc Blatstein. He's a certified health coach. He specializes in diabetes. He's been published in national publications. Diabetes is literally and figuratively in his blood, he says, and we're going to know why in a minute, because he's been dealing with diabetes for a little while. Marc, welcome to this podcast.
Thank you, doctor. Thank you.
It is so very nice to meet you. Would you begin by telling us a little bit about your journey?
Well, I'm 71 years young, and I've had type 1 or juvenile diabetes 61 of those years. I was diagnosed at age 10, September 1st, 1960. And I've worked in the field for at least almost 40 years, teaching people how to smile, laugh, and living with diabetes. Physicians have sent me their patients that are stuck, and I get them unstuck, and I get them smiling again. And that's how I live my life.
Oh, and so you've been doing that your entire adult life? That's been your passion?
About 40 years. About 40 years.
40. Okay. I didn't hear that part. About 40 years is just a life of helping others.
Yes.
On this journey. That is tremendous. And so did coaching itself organically happen as well? Or did you study for that and have a passion for that as a career? Or is that?
I don't charge for what I do. It became a passion when I lost my aunt to complications of diabetes in the 70s. And before she passed, she said to me, "Don't do to yourself what I did to myself and make a difference." She saved my life. I was 29 years old in October of 1979.
And
so she saved me.
Were you not doing good self-care and she helped you?
I wasn't doing the best. No.
And you know what? That is good, Marc, for everybody to hear, because my journey's been almost 50 years with type 1. And thank you. And we've not lived this journey this long and done it all perfect. And I think people need to hear what was our wake-up call, or what were moments of turning us around, or even still, I can eat well today and my blood sugar today not do what it's supposed to do for whatever reason. And I put something in my mouth because I didn't have a glucose tab or whatever that makes me have to take more insulin. Then you go through that cycle. We have those things. Why do you think with type 1 why do we still? I don't think I do as much. The older I get, the less I care what people think. But why do we still care so much what people think when it relates to when we're out having a low and we're eating what we shouldn't, or somebody is judging us? Why is that important to us? Why is that so harmful to our?
Well, I've explained to people about diabetes. I said having type 1 or juvenile diabetes is like riding a roller coaster. You hold on for the ups, you hold on for the downs. And I also say to people that have diabetes is that I learned in 1979 when I lost my aunt to complications. I was her godson. You can't divorce diabetes and you can't fire it, so make it your partner. And I teach people that this is my partner. Whether I like it or not, I can't divorce it, I can't fire it. So yeah, am I over-treating it low sometimes? Yes, and I thank people when they're concerned. I don't run into people that are condescending. I run into people that are caring, because most people know that I just laugh and joke through my life, because that's all. I say to people, this is not a practice run. Make the best of it. Do the best you can do. Do some good each day. And I tell people, when I go low, okay, help me out if I need it. When I go to high, just bear with I get agitated. Just bear with my agitation. It'll come down in half an hour or so. And those are the people I hang around with.
Well, one of the things that I do for myself and I teach others is that when it's low, our mood could change. And that's kind of like throwing us into a stressful situation where it's an emergency, and we were built to handle emergencies. Stress is not bad. If it's an emergency, it'll help you drag somebody out from in front of a car because you quickly jump and do it. So stress is not bad if it's an emergency. We're built to handle it. But when it's over and my mood is still grumpy, it's my obligation, privilege, and responsibility to, when my blood sugar's 80, to get my mood changed back around and be kind to those caregivers and people around me. Have you ever found yourself grumpy because of a low? And people have said to me, of course, I do mental health counseling, and therefore they come to me about their feelings all the time. And what is your feelings about that? We have to not feel sorry for ourselves after the low. We have to get back in the game, right?
I don't feel sorry for myself ever. I smile and laugh and said, okay, I had a moment. We have 3 girls and a boy, and 2 of my girls used to say, uh-oh, he's getting stupid again. Let's get him juice. He's getting stupid again. That's what they called it. Because I would get, where am I? Yeah.
Well, my nephew, which is going to be a interviewee on this podcast in a few weeks, but he would say to me as a little boy, Amy, let your blood sugar go down so we can see you quiet. Because I get very quiet, and sometimes I'm told that my skin pales, and I don't know why my skin pales, but I've had more than a few people tell me that my skin pales, and I mean, like, I don't know what that is. It's a big journey. There's a lot to it, but you know what? I was 16 years old, and if I hadn't had this journey, I probably wouldn't pay attention as much as I do to being healthy. And so
I agree. And I have another saying, man plans and God laughs. It's, we all have something. We all are dealing with something. I'm very sensitive to others. I've been trained. I sat on hospital boards many, many years ago at diabetes boards, Jefferson Hospital, and I was trained by psychologists and psychiatrists how to treat people with diabetes, really how to make them, they gave me a lot of pointers. And I tell people, just, you got to smile, laugh through life. Life's just, it's a journey. Don't waste it. There's some days that are bad. When things get bad with me or my blood sugars go nuts, I turn on Motown oldies, and it gets me right out of it. That's my medicine. That's my medicine. Or I call a couple of my friends, one especially, she's got more titles than I ever heard anybody have, and she has diabetes 64 years, and she's 65. And I've known her for 30 years, and she just makes me laugh and smile because she goes through the same thing.
Well, I think another good thing for this podcast today, if there's young listeners and people who have just been diagnosed, or a 20-year-old that doesn't know what they're going to do to navigate this and how they're going to move on with it. You said your friend's 64 years. You say you've dealt with this 61?
61 years.
61, over 48 for me. We have a good little amount of proof right here. We've got verbal research that we're telling people right now. You can live long. You can be happy. If joy is our birthright, why give it up for anxiety over something that we just have to learn to navigate through and be in health? My feet are good. I am healthy. I'm a little chunkier than I want to be, but I'm working on that too.
Me too.
I'm working on that too. And that has come and gone as the years have passed. And again, there's people that deal with that with guilt, some with embarrassment, some with humiliation, and some with shame. And there should never be shame attached. Never, ever. I do believe in good self-care. I believe it's our responsibility. But, when you have 119 to 200 chances to eat a day, everybody does. And we have to monitor every bite that goes in our mouth. It is a job. And I don't want anybody to think I'm downsizing it it is a job. And so I guess when I run into somebody that is a type 1, I almost feel a kindred spirit, because you don't have to explain yourself. You don't have, we get each other, right?
Yeah. I remember many years ago, I taught about 500 physicians on how to communicate with people with diabetes. And I said to the group of physicians, there's no perfect person with diabetes. There's no perfect diabetes control. That exists in fairy tales. So get over the fact you want a perfect patient with diabetes. It doesn't happen. It just doesn't. You know, it doesn't happen.
But we are strong and powerful and have learned to navigate better than a GPS.
Oh my God! In fact, it's strong. In fact, I should send you one of the stories I've written that got me on TV. I am a second-degree black belt in Taekwondo.
Oh,
not
wow.
Not as active as I used to be, because I wore my knees out and had 2 knees replaced about 4 or 5 years ago, and I'm not able to do as what I used to do. That's why I gained weight, but I'm getting back there now again because my knees are improving.
Good job.
But I proved, and at age 50, I fought in a tournament in Argentina at 50 years old with diabetes 40 years, and I did well against guys in their 30s. I'm not a tough guy, but I took Taekwondo and Judo back in the 70s, 80s, and stopped and went back again in the 90s because I faced a lot of anti-Semitism. And I was never a tough guy, but I was always the guy that helped others when there was those kinds of problems. I don't believe in harming God's creatures, but sometimes you got to stick up for yourself and others. It's the way it is.
That's so good. That's such a good mindset. So when someone is in need and they call you, what's some of the tips and pointers that you typically guide them toward?
First, I analyze what they're doing. I ask them a lot of questions. I ask them, what type of diabetes are they? What kind of doctor are they seeing? What are they doing? Are they checking their blood sugars? And how do they feel about it? Tell me because the problem with medicine, in my eyes, and I've sat on a number of boards. I sat on like 15 boards in my time. Is that when a person is diagnosed with diabetes, type 1 or type 2, they go into the doctor's office, and the doctor, diagnoses them after they had a blood test, and says, take 2 pills a day, check your blood sugar 4 times a day. Here's a sheet of what to eat. I'll see you in 6 months. That person walks out of that office, and a friend of mine coined this, and has diabetes overwhelmness. They're overwhelmed. Oh my God, what do I do? I don't understand. And they're put out into the world, and that's why most people with diabetes don't succeed, because the TLC they need is not there. It's just not there. The psychosocial issues are what drives a person with diabetes. And when I have taught physicians, and I haven't done it in quite a while, I say to the physician, you telling that patient to take the medication or here's a sheet of what to eat isn't going to fix them. Sitting down with them and explaining them, I'll be there for you. What do you need? How do you feel? Are you going through anxiety? As you know, the psychosocial issues drive you to compliance or away from it. And there's not enough. And I've always dealt with the psychosocial issues. I've counseled some movie stars, some actors, actresses, some sports figures. I can't talk about it, but I mean, they have the same problems you and I do. I remember years ago when I'm a past president of Juvenile Diabetes Foundation, I used to have dinner with Mary Tyler Moore.
Oh,
what a nice lady.
Type 1.
What? Yep. Mary Tyler Moore couldn't deal with her diabetes. Couldn't deal with it. And she had lost a child. She had alcohol problem. She was as nice and as sweet as can be. And I tried to help her, but she was so stuck from things in her life, but she was kind and she always helped and always did. And I've met a lot of very cool people in my time that have type 1 diabetes. And they're just like you and I.
Absolutely. Absolutely. And when we see those people with anxieties, and of course, that's what I'm working on right now. At this current moment, I'm working on a program to get the anxiety, that prolonged worry that is harming us, that we don't have to live in. And it kind of starts at a whole other end, that I want to work on the core with people rather than the symptoms. But when we first get diagnosed, sometimes it's a little traumatic for people, and they don't get referred to me until they pass the few months of trying on their own. And if I could, not for me specifically, but if I could push the doors open for those that follow me in the mental health arena, if if they could get a diabetes educator and somebody with nutrition, and they could get somebody in my field, that we could start working then on how that is affecting their moods and their feelings, because emotions are not the boss of us. We're the boss. They are great followers, but they're not good leaders. So there's a way to learn to lead them until they don't harm us. But when you go in, and if you're 25 or if you're 16, I was 16, and when you are diagnosed, it's a little traumatic if you don't know what you're doing, and if you've seen a grandparent die from the effects of it, and so right then is when we should start working. So I'm glad you're there. Not only can you help people recognize their emotional needs, but you know what it also feels like when I don't care how old you are or how young, adjusting yourself to needles takes a while. Now, I just do it now, like pop, pop, pop. I don't even think about it. But that is a big deal when somebody is first diagnosed.
My mother, may she rest in peace, she was my caregiver, and she was my rock. When I was diagnosed in 1960, she had to boil the syringes and sharpen the needles. They weren't small, but she was there. Without her, I wouldn't have made it. My father couldn't deal with it. He was totally overwhelmed with the whole thing. My mother was the one that was my rock. She was my rock.
Well, I didn't, in the early 70s, I didn't have a monitor. Like, my phone tells me right now, before I got on with you, I just looked at my phone. I knew what my blood sugar was, and I'm ready to go. But, and so I never take it for granted, because dare I say, when I started back when, I peed on a stick. I didn't have a monitor right at first.
Absolutely right. Well, the first monitor my mother got me, I think it was 1975. She comes back to the house, and she brings in this, looks like a briefcase. And I was living in an apartment. I'm 25 years old. She says, I got you a glucose monitor. I said, what is that? And she says, here, let's try it. It's a briefcase. I opened it up. She's trying to read the instructions. It was horrible. So I said, Mom, let me work on this for a couple days. So finally, after 2 days of trying to get to work, I took it outside. I rode her with my car and said, I'm done with it. Threw it in the trash. So that's, and I laughed and joked, but that was my first meter. But I'll give you a funny story that, you can share with some younger patients. When I was diagnosed in September 1st, 1960, the first thing that came to my head, I'm a 10-year-old little boy. I was a rambunctious boy who became a rambunctious adult. I smile and laugh at everything in the world. And that's the way I get through my life. And I remember one of the doctors telling me, Mark, no more cake, candy, and ice cream. I thought my life was over. No more cake, candy, and ice cream. So my mother, Children's Hospital for 6 weeks and 1 day. Why to this day, I don't know. My doctor was one of the founders of Juvenile Diabetes Foundation. He's the one that taught me to smile, laugh, living with diabetes. Dr. Robert K. I loved him. He was a gift to me. So I remember when I got home, my mother says, I'm going to go out and want to get you some diabetic chocolates. And I was excited. She goes to Center City, Philadelphia, comes back a few hours later with this box of beautiful chocolates, sits me down, gives me a glass of milk, gives me 2 chocolates. She said, the doctor said you're going to have 2. I looked at it, I smelled it, I was happier than a pig in dung. Hands me the chocolates, I bite into one. I said, oh my God. I spit it out. The aftertaste lasted a month. It was horrible, 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 horrible. My poor mother, she said, I tried. I said, Mom, thanks. Then a month later, she went with my grandmother came over to take care of me. She went downtown again. She's going to get me diabetic pound cake. Pound cake? Wow. 10 years old, I can eat cake again. She comes back with this pound cake. It looked beautiful. She cuts a piece off, gives me a glass of milk, gives me a fork. I take a piece of it. I put it in my mouth. I started to choke. I said, Mom, I thought you loved me. It's like sand. I was choking. Mom, what are you doing? So she felt bad again, but how can I tell you? So I figured I'm going to find a way to get candy again. So I remember going up, I'm 10 years old. It's probably in the wintertime now. I was diagnosed in September. And I go upstairs to the bathroom and I smack my face and make it red, take a sponge and drip some water in my face. Mom, I'm low. Let me get you juice. No, juice won't work. Get me candy. Get me candy. So I talked her into getting the candy. This went on a few times till she got wind of my game and says, I know what you're doing. But I was always a jokester. Always a jokester.
Oh, that is the best medicine today for any of us. If nobody else enjoys it, we that have had to monitor our foods our whole life, that is the best medicine we could get. I so appreciate it. The best things I've heard today, and then we're going to get off here. I'm not going to keep you much longer. The best things I've heard today is learning as a little boy how to laugh and smile through it. Because, sir, if joy is your birthright, there's no need to let disease, right, rob you with anxiety and fear and all those things that you just override that with the joy and the laughter and the smiling. That is amazing. I guess the running over the monitor is the best story ever. Everybody needs to hear that in the whole wide world of diabetes. And then slapping your little face, making it red, running water to make you look like you're to make you look like you're sweating.
After the third time, she says, I know your game. What I do, Mom? What I do?
Because, you sweat. If it gets too low, you sweat. What 10-year-old would think about putting water on their face? That is hilarious. That is so good.
I wanted my candy again.
Oh, that is so good. That is so good. And we that have been there, we're not wanting to be snooty. We're not wanting to push it that we went through more, but we do want those that are younger, right, to appreciate and value the technology and the medical advancements. And still, in my field, in mental health, we're still lagging a little behind, but it's getting better. Doctors used to tell me they would love to refer their patients to me, except they don't want them to think they're crazy. And it had nothing to, when you hear mental health, you think mental illness and you think something terrible, terrible disease, when all it is if you're a little anxious or you have a little fear of the needle or whatever, I can help you. Come on over. Let's sit down and talk about it, right?
The first story I wrote 20 some years ago was called Winning with Diabetes. It got me on TV because I said to myself, I'm not going to talk to people about the negatives. I'm going to talk to people that smile and laugh and deal with this. So I titled it Winning with Diabetes. That
is so good. It's been a joy to meet you this morning.
Same
I will
here.
Tell everybody that we are on different time zones, and we had a minute connecting right before. And
I'm sorry about that.
It's not anything bad. I'm just saying about that. You put old timers with diabetes together, and we can have a little difficulty with technology, with time zones, whatever it is, and we make it work. And so you just have made my day. It's a joy meeting you now. I know you say you don't do this for a living, but where can they follow you? I know I have you on LinkedIn, but if you would say what your handle or whatever we call that, where people could reach you if they want to follow you and stay with you.
Well, I'll give you my email address, and
Okay.
I'd like to get your email address because I want to send you a couple things. My email address is your diabetes health coach at comcast.net. YOUR diabetes health coach at comcast.net.
All right. I hope everybody got that. Anybody need a smile and a laugh through a hard moment today, and that's who they need to contact. I hope they do that. It has been a pleasure. I wish I had thought and run over a few monitors in my time. Wouldn't that have been fun? And I wonder if this causes us to be a jokester, because that's what I've done more than my mother would have liked. But sometimes, and they all know I'm kidding, but if family's around and they're eating something, I'll say, "Oh, I think my blood sugar's low."
Yeah.
Oh, they know me. They know way too soon. They don't think it's real, but Thank you, sir, so much for
Doctor, thank
joining
you.
me today. And you keep smiling and you keep laughing and helping people.
You too, doctor. Thank you. Take care of
Thank you
yourself.
so much. Bye-bye now.
Bye. Bye.